I appreciate the opportunity to have what I will call a keynote conversation with you because I don't really think about this as a presentation or a speech. And if you think it is, then you have the wrong guy up here for sure. I was a little bewildered when I got the invitation and about exactly the perfect relevance that UnitedHealth Group's experience might have to all of you. And it crossed my mind that you might have been desperate for a speaker of some sort. But I then turned it around and thought that if, in fact, we could have a productive conversation, that would be a pretty good use of time. So I'm not going to give a 20-minute infomercial about UnitedHealth Group. I'll give you about 2 minutes so that I can give you a sense of kind of the scope of the enterprise so you could get a perspective of what we see in the marketplace. I'm not going to dwell on healthcare politics or policies in particular. If you want to get into that a little later on, that'll be fine with me. I'm prepared for that. But I'd like to take a day off from that and talk about something else. So I'm going to keep it short. So the quality of this conversation will be very much around the quality of your questions. I will start out with a couple of minutes about UnitedHealth Group. Its mission is to help people live healthier lives, and that really is a mission that is deeply felt. And the role of our business is to make the healthcare system work for everyone. So you'll see in a minute that we're kind of displayed across the healthcare landscape. UnitedHealth Group is organized around 3 underlying competencies. What I'll call domain knowledge about how healthcare resources might be optimally organized and deployed so you get the maximum productivity, best outcomes, best efficiency from them for the most people in the marketplace. The use of information skills to take the enormous volume of data that's characteristic of healthcare and be able to translate that into something that's actionable, what we call actionable intelligence in healthcare, and connect it into the system. And then lastly, enabling technology. So we think of ourselves as a bit of a healthcare system, perhaps a more modern, more virtual kind of business that is organizing resources in local markets, recognizing healthcare as profoundly local, and that there are meaningful differences in local markets, that we are connecting it with enabling technology, that we are informing it with information that is relevant and trying to bring it to the point of decision making for both the consumer and the care provider, so both sides of the supply-demand equation. And we do that through 2 basic business platforms, 2 domains. One is called UnitedHealthcare, and that is our benefits business. It serves, in total, just over 75 million Americans, individuals, about 40 million in full spectrum of major medical, and the balance in a variety of other services or parts thereof, but the 75 million unique. It serves the commercial marketplace in all sectors. It serves Medicare, Medicaid, the military, and it would be the market leader in all those categories. And the other side of the business is called Optum, and it really focuses on the health services domain. So working with 6,000 hospitals, 70,000 pharmacies, 250,000 practices in the country, 300 payers, 400 life sciences businesses, 300 government agencies. That business is really into the kind of the central nervous system of the healthcare community. Again, using technology, using information, and using domain knowledge to see if we can advance the system in total, make it more modern, make it more effective, more productive. And we deploy against those 2 platforms, one much more regulated than the other, one much more mature than the other. And in total, we think about it as being about 75 million Americans connected very structurally to about 85% of the healthcare delivery system in an open market kind of context, 750,000 physicians, 5,500 hospitals, 70,000 pharmacists, 1,000 labs, about $110 billion in revenues in total, about 115,000 employees. Interestingly, 16,000 of them are totally dedicated, are clinical in their background and totally dedicated to clinical services. About 12,000 are totally dedicated to technology. We are a major technology user. We spend well over $2 billion a year in technology to make that system I describe work. And that system is the size of a good-sized country. Great Britain's got 62 million people, France has 62 million, Germany's got 80. So it is an interesting model of a healthcare system. That use of technology helps us capture data and use it effectively. We transact at a very high level. We have about 80 billion transactions a year, about 1 billion of them on the internet. We have a consumer database that it tracks about 170 million Americans, and it tracks them over meaningful periods of time. And it's an organization that we think is innovative and has increasingly become more innovative. I think it has natural instincts along those lines. But we really tried to open them up in the last couple of years, and it'll get to kind of the core of the message. We were a winner last year of the Product Development and Management Association Award, the PDMA Award, which is, we think, the first healthcare company that has actually been the award winner in that domain. We were Fortune's most admired in managed care for the last 2 years. So it's an interesting place on the field, kind of somewhat in between supply and demand. We are, in many respects, making a market in healthcare when you think about having a transactable base, our technology, using information to make that market more efficient, and then working with the assets across the supply-demand continuum. That is kind of the model of UnitedHealth Group. And so it strikes me it might be relevant in terms of if I was talking to my own folks today, which is when you look at the content of what I'm going to touch upon, could easily be translated directly to them. The same things that are hitting us, we think are very much connected to you, and we're kind of in this together. So what are we seeing from our spot on the landscape? And it's pretty simple. Consumers, employers, governments are all demanding much, much more than they ever have before out of the healthcare system. A sea change from that perspective. We are seeing more change in the marketplace. We're an organization that does a lot of study than we think we have seen in perhaps the last 30 or 40 years, which is about the time frame it's taken us to get to kind of this threshold period in healthcare. They are demanding more value. They're demanding more consistency in performance. They're demanding more personalization, higher levels of compliance. They expect our businesses to be able to comply with whatever regulations, whatever rules the market comes to. They're demanding greater levels of access, at the same time specialized or segmented kind of access, flexibility, choice, convenience, simplicity, personalized technology, information and education as they come into the marketplace, tools to navigate the healthcare system and make that, to help them make decisions, educate them and make better decisions, and transparency. They want to know our costs, they want to know your costs, they want to know how good our business is, they want to know what the quality and trajectory of our services have been. They're going to want to know the same thing with respect to the effectiveness of your products and services and how cost effective they are. Because at the same time, they want that more for a lot less. They pay today, on average, across our book of business, roughly 30 cents on the dollar, which is a significant change over the last 10 to 12 years in terms of how much the consumer is actually paying and is conscious of what they're paying in healthcare. They are asking questions that they have not asked before. And they're kind of irritated when they're not getting the answers. They want lower costs. They want to know how much something really costs. They want to know why it costs so much. They want to know how they can get it for less. They want to know where they can get it for less. They want to know if someone else can get it cheaper for them. Is there any way for them to get it cheaper? Will someone else, can I find someone else to pay this for me so it becomes cheaper for me? Is there a deal to be made? If I can wait, will it be cheaper or a better product later? And how long do I have to wait? They want us to educate them on becoming good consumers of healthcare, hopefully responsible consumers of healthcare. And they want us to enable them to negotiate in the marketplace. And a lot of the change, a lot of the design of our products, the technologies that we're bringing forward is really enabling the consumer to get engaged, to make choices, but clearly to navigate the system and to negotiate around costs. These were the kind of questions, the kinds of interests that just weren't there just even 5 years ago. So the consumer is coming at us with great pressure. They're coming at their employers with pressure. So let's pause for a second. The consumer wants significantly more for significantly less. That is a shocking revelation, right? No one in retail has ever heard this before, right? No one in technology, no one in travel or in consumer electronics or in music or videos or in any other sector. And I think they're serious, and what we see is the technology, the information, and the path for them to begin to get at that. What do we see as the market forces when we sit back and say, what's really happening to our business? We come down to two relatively odd bedfellows. The first is the consumer, and the second is the government. And it is clear that they are not in sync or aligned in terms of their interests. We consider the consumer to be a very real market force. It is basically leveraging its wants into the marketplace, and over time, other markets have proved that that generally ends up being a good thing. It makes the market more efficient, makes the market more productive. And they're learning at very high speeds. As we measure, and it's impossible for me to show you the kinds of things that we're doing, but it is amazing the level of granularity in which we're evaluating how well consumers make choices, what kind of information they look at. We are becoming very much invested in the consumer's intellectual journey into healthcare. They're going to drive simplicity, they're going to drive ease, they're going to drive convenience, they're going to drive costs. The government is what we'll call a created market force. It is the major regulator and buyer in healthcare. It sets the rules for the broad marketplace, some of which work, some of which don't. We could have an entire afternoon therapy session on that subject alone. And they're also a major buyer. And when they come as a major buyer, they bring their own view of what quality and what they want is. And that is also often framed from their position in the bureaucracy and position in the political world. So that may not be grounded in market realities. It just may be what the government as a large buyer wants, just like a large corporate customer might. But it is it's so large, it's a factor that has to be dealt with. So consumers are shaping the value proposition in the marketplace while the government is establishing basically the market and the economic rules. And as I said before, they're not necessarily in sync. So what comes for us from that are two real themes. So if you believe that our business is constructed, obviously everybody can have their own view of that, but I obviously believe the business is constructed in a good way. We are well deployed against the benefit space. We're well deployed against the delivery space. We've got positions in both supply and demand. We've got enabling technology in the marketplace. If we then want to say, now what are we really going to drive? We're going to drive two things. We're going to drive innovation to try to create more value. And then we're going to be very much focused, like we have never been focused before, on what I'll call cost enablement, which is so that the consumer can get at this, the government, the corporate sponsors can get at healthcare at a distinctively lower cost. And when I say that, think in the context of 20%. So not in healthcare, and so many people talk about quarter percentage points, half percentage points. We're talking about real meaningful change. And one of the things that we're learning is really what kind of moves the market. Our view of innovation as an enterprise within the enterprise is somewhat what I'll call incremental by design. So we are thinking about paths for innovation, about how things can be evolved and adapted so they can go into the marketplace and be accepted both for the consumer and in the care delivery space. Themes around simplification, themes around modernization, the most basic modernization, getting the delivery system connected, getting the basic information through it, all staged to market acceptance. Kind of bringing about enabling capabilities so that once you bring those enabling capabilities on, now you can layer on the next thing, which might be features or incentives that would allow you to then change how you might pay, which then might allow you change how you might demand or what you might ask for. So think about what the performance measures need to be ahead of time. So it's very much a staging kind of proposition. Practical, it's what we call approach-based. So we may not be doing engineering. We may be doing kind of economic and social engineering about how healthcare resources in a particular marketplace might be best organized and arranged. And very much, as I said, evolving. On the cost enabling side, we focus on product designs that allow consumers to engage and participate, providing information for making better decisions, giving consumers choice so that they can make the trade-off between quality and cost, that they can discern for themselves what level of resource they want to use, how they want to use those resources and for what, to begin to educate them about how they might make those kinds of decisions, navigate the system. We work in leveraging their buying power. At some level, what I'll call a comparative effectiveness between services and products that might be available in the marketplace. And we do it, again, and if I go back to the approach that we take to innovation, we do it from a staging kind of evolving point of view. So if we are developing the kinds of tools that consumers can use, can I design products that consumers can begin to engage on and get connected to? Can I design the consumer engagement tools that they can use in those products to make those product designs more effective? So think about incentives, tools and information so that they can use those incentives effectively, clinical programs that they can engage in to earn those incentives, tied into the delivery system that is now contracted in a way to work through that, and a care provider that has his own set of incentives that align with all those. No one has ever really done that before. And from that, can I get consumers to make better choices about what services they may use, what resources they choose, shop for cost so that you get that kind of efficiency in the marketplace, and can I get a delivery from the delivery side, an engagement level that allows them to participate if we are developing a more efficient model. Everything we are selling, and maybe this is the most important thing, everything we're selling today, that's part of we're a pretty well-growing company, is in these new designs, is in very low price points that represent high levels of consumer choice, high levels of consumer enablement around discerning between quality and cost. That's on the benefit side. And on the delivery side, everything that we're doing that represents real growth and future is around enabling the delivery system to participate in that as well. Accountable care organizations, integrated care, whatever handle you would want to put on it, to allow them to start using information, understanding and seeing their consumer, begin to develop the kind of skills that they might participate economically if in fact they can produce better outcomes. Do that for other payers. Do it for employers, do it for governments. We do comparative effectiveness in the life sciences. I said we serve about 400 companies in that space. Develop and deploy clinical programs around significant diseases, diabetes. We won the PDMA award for our diabetic health plan. around oncology, around healthy pregnancies, around transplant programs, fertility programs. Let me give you just a couple things that we are doing or what our ambitions are. We're hoping, we developed, along with the manufacturer, we think a very effective, very cost-efficient, low-priced hearing aid with some interesting approaches in terms of how consumers might engage, take hearing tests, begin to engage in that. And we're hoping to sell about 250,000 of those hearing aids embedded in our Medicare benefit offerings. We have a partnership. We took some intellectual property that was in the public domain, developed by the NIH, around programs that could be effective on diabetes. We partnered and created a partnership with the YMCA, with retail pharmacists, with our own organizations who were paying through the marketplace to engage in this kind of alliance, and developed the Diabetic Healthcare Alliance and a diabetic health plan. More benefits, all built around the life of a diabetic, engaging them and the research to determine what's the market for a pre-diabetic, bring them into the program, sold them to about 150 clients, available to about 2.5 million Americans. An amazing, I'll use our own organization. Our own organization engages in what I'll call a healthy rewards offering. 78% participation rate in our own designs around paying incentives for about $500 to $600 incentive to engage in our programs effectively, whether that be diabetes, cardiac care, smoking cessation, healthy pregnancies, whatever that construct works for you. You can earn about $500 or $600 off your premiums. And if you stay with those, you can continue to earn. We have about 78% participation rate. We have a flat trend. We've had a trend in our own book of business, 115,000 employees. So take that times about 1.8 in terms of beneficiaries. And have had a trend of about 5% or less for the last 6 years, all on a consumer CDHP kind of plan, about 30% participation rate. Strong levels of satisfaction, strong levels of participation, meaningful cost reduction. Each year, like last year, we found 400 people within our population that were diabetic and didn't know it. As an institution, I can tell you UnitedHealth Group lost 9 pounds last year. Oncology, we've developed a program where we can basically unbundle the practice from the product, the drugs associated with the care of oncology. We focus our oncology programs on high-performing clinicians who get actually paid more for taking on a complete oncology bundle, and we pay and contract for the products separately. So we have separated and unbundled the drugs from the clinical practitioners, and then we have basically gone after the drugs in terms of buying them with our buying power and bundling the services around oncology to the practitioners and paying them more. We have mobile applications. We put one out just a few weeks ago. It's called Health for Me. We're probably the largest producer of mobile applications in healthcare. It is, I'm told, as of about 45 minutes before this venue, that it's the 11th highest free application on the web since it's been released just about 6 weeks ago. It's called Health for Me, and it consolidates for us all the mobile applications we've had into basically one package. 11th highest, and it only uses our base. So those are the kinds of things that we are driving and developing. These are the kinds of things that are growing in the marketplace, and it is clearly an agenda where we are driving innovation throughout our organization, both internally, which I would say is an incremental kind of evolving kind of an approach, and our more disruptive innovations we do outside. So we will develop and have our own venture capital kinds of arms, or we will invest into a venture capital place where we think we are seeing areas of interest to us. And when we want to do something that's more disruptive, we'll do it outside the domain through those kinds of arms, and have been doing that for many years, maybe at about a level of about $300 to $400 million at any given point in time invested in that space. So from our perspective, the market is setting the bar high. The consumer is telling us that they're coming into this space and they expect a great deal more from us, higher levels of performance, consistency, and a much better cost offering, and a lot more choice. Much stronger levels of personalization, technology that works all the time. We may be the best from a pure operating point of view in the marketplace. Let's just assume for the moment, friendly company that we are, at 80 billion transactions. If I just take 4 decimals off that, that means if I have that much of a defect rate, then I have 8 million defects in the marketplace over the course of a year. That's a lot in healthcare. That's a very intolerant space. Every defect in healthcare has to be corrected. There's nobody that doesn't want a defect in healthcare in our business not corrected. So the bar for us is extremely high. And the government is coming in and setting its own rules. Some of those are actually at odds with what we think would be good market practice. But we have to comply with those rules as well as the largest customer and the largest sponsor of healthcare. But between those and engaging with those, what we see is an opportunity for this space to get meaningfully better. It takes, for us, enormous scale, tremendous levels of investment year after year before you get to a tipping point where there's really a threshold that you really are starting to differentiate, starting to actually provide a much better value at a much lower cost. But we see the opportunity for that. We see it in the things I've just described, and we see it very much in the coming years. So if that has warmed you up enough, would you like to see if are you seeing the same things? I'm used to these long pauses. Go ahead.
I'm not from Minnesota, really, so I'll be one of the first ones to speak up. Wondering what intersections you might see with our technology community, even just here in the Twin Cities. Can medical technology companies, for example, access some of the insights that Optum is coming across? By the same token, do you see, opportunities to co-develop new products with any of the companies here in town? We realize you're national and maybe even beyond national, but are there opportunities to work right here in the Twin Cities?
Yeah, actually, we do, I think, a fair amount of work in the Twin Cities. I think we are work with a number of companies here. This whole hearing aid undertaking was done here in the Twin Cities. I'm hoping, I am told, that we are networked in a reasonable way across the Twin Cities in terms of this community, which we think, to Dale's points, is very rich with respect to healthcare knowledge. And one of our interests in terms of the medical technology community flourishing here is because it does provide a very rich base, and a lot of those folks do come into our domain. I would say at least 2 of our venture arms are based here in the Twin Cities and have performed really well and are very productive. So I'm sure we can always do more, but I think we have a pretty good network of connections across this community. And certainly open for more. I think we're a very accessible organization. You could tell me whether we are or not.
I was in a meeting last week with Don Berwick, and the question was asked to him, how much does Washington matter going forward? And it was interesting to hear him say that he didn't think it mattered that much. And the reason he said that is he says he thinks there's such momentum behind reform from employers, from the states, the private sector, that reform and improvement of the system is going to just march on ahead regardless of what happens out of the Supreme Court, regardless of who wins the election, that he sees it continuing to go forward without having to have a lot of support and drive by Washington. I'd be interested in your thoughts on that.
I would agree with that, to tell you the truth. I think and I would tell you, using our own company as an example, we were into a lot of the things I've talked about. We didn't jump in those in the last couple of years. We have been driving this same agenda, whether healthcare reform was going forward or not, and we'll continue on that agenda. What I would tell you, reform did, in whatever it raised the national consciousness around the issues around healthcare, and it may have struck fear in the hearts of some to get them more engaged, but we're seeing relationships and working with organizations that you just wouldn't have worked with 5 years ago. And they're dedicated now to continuing those kinds of relationships, and many of them are driven either by thinking that they either need to do these kinds of things, let's say get more integrated into the marketplace, I'll just use as one theme, because that's survival, or they're doing it because they think they're going to succeed and build their businesses and be more dominant the more they engage in whatever direction they're headed, and the directions are relatively similar. So I would agree very much with that in terms of him saying the catalyst for change is in the private market today. I would agree with that. I think actually Washington could hurt this very, very profoundly because I think that much of that regulation is not well thought out, that it is, at least the reform legislation was very much around expanded coverage without really addressing and looking at the system in total as a system, and we think as an organization very systemically. And I can imagine we could align on this, and that is the taxes that have been embedded in this change are very counterproductive. That all you're going to do is embed and burden spaces that are really the only opportunities to bring about real change, sustainable change. You're going to burden the enablers of change in healthcare, whether it's organizations like yours or like ours, by embedding and layering in tax burdens that they could not achieve otherwise, that are going to be costs. They're going to be inefficiencies in the system, and they're going to be, it makes capital formation and the cost of capital so much higher. So things like that, and I would say approaches to the marketplace that are impractical, that don't translate. So a lot of the changes around the things that I'm most versed in would be exchanges, essential health benefits. We think should be allowed more time frames for development, allow much more freedom in terms of the local venues to pick them up. And what we see is Washington very much pressure to get regulations out so that they can get as much of this in place while they're in the political status they're in. So that's where I worry about Washington. But I would say Berwick is absolutely right. The appetite to drive change and to what we'll call open market integration in the marketplace is quite strong. Yeah.
I thought your comment on hearing aids was very interesting. Do you have a strategy for developing or assisting in the development of products which you, from your perspective, deem to be overpriced?
Well, let's not say overpriced. So what you should read into my commentary is, if we are really sitting back saying that this organization was historically a benefits enterprise that served sponsors in the marketplace, employers, governments, and so forth that came in and basically did funding for benefits, and we are really crossing the chasm into the consumer. We're going to focus on everything that can make that consumer's life simpler, easier, lower cost, more effective. Can we be an effective organization, not only educating and informing them, but can we bring products and services to them more effectively? Can we use technology along the way, particularly recognizing how generationally, in the span of 10 to 15 years, the use of technology in the marketplace is going to continue to drive. Everything will be mobile. We will be a completely paperless company. And can we facilitate the consumers' access to goods and services in healthcare or for well-being? Yes. And hearing aids was kind of easy and very much aligned to serving the seniors. And will we be restless or looking for other areas like that? We will. And we'll be very much educating consumers about what products and services work, why they work, what should they be paying for them, what can they expect, and how should they go about buying goods and services in healthcare. That's what they're asking us. That's what we're coming back to them with. And then we're facilitating that. And I think hearing aids is just one example of that. So will there be more? That's our plan. Diabetes actually is another. Many people don't really know how to completely engage in that. You recognize that healthcare is also a good part social work, and a lot of people aren't prepared for some of the challenges life throws at them. If we can help organize the resources and organize them to become much more effective, if we can forestall someone from the onset of diabetes by identifying somebody with the markers 7 years before it will set out, and we have the data to do that. Engage them in programs that gives them the ability to potentially forestall diabetes 10, 15 years, possibly indefinitely. What is the value of that? It's enormous when you recognize what someone with full onset diabetes has and what the quality of their life and what the cost will be. And that's why the potency of the DPCA program is. And what's amazing is that the intellectual property for it has been around for about a dozen years and has not really been brought to the marketplace as a program, and that's what we did. Yeah.
Thanks for talking a lot about technology and a holistic approach. There's been a lot of discussion that technology, particularly medical technology, is driving up the cost of healthcare.
Medical technologies are what?
Is one of the reasons that healthcare costs are increasing significantly. But when you look at the macro data, 2.5 trillion in healthcare spending a year. I think medical devices represent under 5% of that. What do you think the disconnect there is between the national discussion about technology and medical technology driving costs when, again, looking at the data, it represents such a small portion? It's more on the prevention side maybe that there's an opportunity to have real savings.
So healthcare is a space that is full of this disconnect between what people think and what the data says. So the conventional thinking is that the advancement of products and services into healthcare, and I think there's some truth to this, just adds layers of additional products, services, protocols, et cetera, and nothing ever goes away. And there's some truth to that, because when you bring something new to the marketplace, before it really gets fully embedded in the marketplace, and whatever its predecessor protocols were or products are really pulled back from the marketplace, is almost a generational change. So you get basically two layers. The change dynamic takes way too long in healthcare to occur, and you can measure that, and it does add costs. But at the same time, I would say there has been an observation, too much incremental change, products and services that have come into the marketplace that really don't drive that much difference. And so what we're learning as a company, I would offer as a learning to you, if you don't drive about a 20%, so that is a change that can really be felt in terms of an outcome economic kind of delta. If it's not kind of in the 20% range, then I would question how much I'm spending developing that new thing. Because if it is not bringing that kind of impact to the marketplace, then I think the consumer is going to be very slow to recognize it and value it. And I do think what I'm learning about the consumer is that they're going to ultimately make the decision at the end of the day. They're going to take their input from a variety of places, but it is not going to be one of these small incremental changes that my product provides a slightly incremental advantage and it has perhaps a meaningful cost difference, or even just when I really take a look at what consumers choose when they get the opportunity, it is really sobering to realize what the standard for performance is going to be. And then I'll take you to international travels, and you take a look at in countries where they are getting very respectable health outcomes, and they're using products and services at much lower levels than we are. You're seeing what I'll call in high-performance clinics. So in our neck of the woods, when we begin to engage with the clinical community, we are obviously very much discerning who performs better than others and who's consistent at it. And when we look at what I'll call high-performance kinds of clinics, the products, the services they bring together, the kinds of technologies they use, the kind of responsibility they take for performance, and the kind of consistent performance they get at using much lower levels of products, services, and technology than others, or using lower cost technologies to accomplish those things. It is pretty impressive, and those are cost differences of between let's say 25 and 35%. So all I'm really saying is that to my way of thinking, the market has changed. The expectation of something having an impact is pretty high. I don't know if that answers your question, but.
It kind of makes the services and the products together. I think, we can't control whether the costs are not delivered that year goes up at a higher rate. So I think, again, the device companies perfecting the device itself that's 5% or 100%. We can't control if the doctor rates are going up or the hospital costs are going up. It's somehow, I think we're getting lumped in as, well, without the device, we have all ancillary services, so therefore you're stuck with the entire suite of those.
So I'm sympathetic to that, but the fact of the matter is you're stuck in exactly what you described. So that is your problem. And that's why, because I could make the same case about it's not me, it's the other guy, right? The fact of the matter is, from the consumer's point of view, all they care about is, I want to get back to where I was before. I don't want this to cost a lot of money. I expect whatever you tell me and so forth will work and be effective. And you need to be thinking about your products in that context, so then you have to be thinking about what setting your products go into, about how well they can be impactful. Yeah.
So I can appreciate your comments around streamlining healthcare costs with existing tools and products. Some of the technologies, devices, and diagnostics you referenced and that are developed by people in this room are breakthrough technologies that don't have pre-existing payment structures, although could benefit patients and potentially reduce costs, we hope. Do you have initiatives internally to encourage those new technologies to get paid, or do you have ways that you're going to, you envision your organization looking at those technologies and welcoming them in a constructive way that would allow small companies to actually get to the point where they can prove the data and show you the data?
I think we do, particularly given the fact that we serve a lot in that community around expediting the process to get regulatory approvals and so forth. We're held to the same kinds of, we share an issue about how quickly good products and so forth get to the marketplace because of the very rigorous regulatory hurdles that they have to get through in this country. So we're very much aligned in our interests along those, and if we can actually be helpful in any way in terms of moving those kinds of processes along. But when we see something that has gotten approval that we think is a distinctively better approach, I think we're one of the companies that is most aggressive in terms of putting it forward. But then you have to get to the point of, well, how do I get that done? So the way we do that is to really focus in the marketplace, again, to the same notion of where are the best places and who is most likely going to be adopters of this so that we can design products and programs to get those people to those places so that that technology is driven, and then we'll pay for that. And we'll pay for those kinds of outcomes. If you take a look as a company, we pay about, let's say we are about $150, $160 billion a year in medical spend. 15% of our spend is performance-based. That would probably be the highest percentage in the space. And we're on a path to drive that to like 25%, like in the next 2.5 years. And clearly we're looking to be in the 60-65% range within, let's say, a 5-year glide path. That is a pretty ambitious pattern. And we are actually seeing good traction in terms of getting those kinds of outcomes. We are really driving that to places that we think provide the best outcomes, consistently the best care. Those are the same places that are going to be the high adopters of those kinds of very positive, disruptive kind of technologies. And we'll be paying for them, and we could very much align ourselves with those. I would also say that the day is coming when we're starting to get involved in what products and so forth a hospital or a practice does use, because we'll have a point of view about those, and we'll also have a point of view about what the cost for those should be. So I do think we are in that, but we're in it. That's our approach of how we promote it in the marketplace. If we could be more explicit on that around things that really do work, we would come out and be that way. Had enough? Thank you very much.